Hello, hello, everybody. This is your host, Darshana, and today we have with us one of my favorite people, Fiona. Hello, Fiona.
Hi, Darshana.
I'm going to speak a little bit about your introduction and then I'll give the floor to you. So, Fiona here is a licensed marriage and family therapist, a sex educator, and an ASEC certified sex therapist. In her practice, she works with clients on issues related to sexual identity, dismantling sex negative messages, and enhancing pleasure and intimacy. She's the coordinator of sexuality therapy and sex education certificate program at the Antioch University in Seattle. And the classes that she teaches are about human sexuality, sex therapy, relationship therapy. One of the coolest things is Fiona's really dedicated about expanding sex education resources to be inclusive for body diversity and to challenge binary thinking. I am really excited and really grateful that Fiona's here today to talk to us, and I wanna hand this over to her to kind of tell us a little bit about how is her journey been so far. How has she kind of landed where she is right now?
Thank you so much, Darshana, and thanks for having me join you today. um, I would say that my journey was probably pretty typical for what a lot of therapists experience. So, my training and background is in a particular kind of psychotherapy that works with people in relationships. So, we primarily see more than one person in the room. So, this could be couples. This could be married couples, this could be people dating in relationships, and then this could include families with children. We do see individuals too, but the way we think about it is always in this relational context. So when I was going through my training program, one of the requirements, accredited program requirements for marriage and family therapists is they have to take a human sexuality class. And when I took that class, it basically just changed my entire world. And it was a bigger change for me than it was professionally. But I just learned so many things. And I thought, why doesn't everybody know this information? Everybody needs to know this information. And so really from that point onwards, I thought, this is what I'm going to do. This is what I'm going to spend my time on. So I worked primarily in community mental health settings with families and folks in the community and did that for a few years after I had graduated. And then finally, it was time to kind of turn my attention towards getting the specialization in sex therapy. And sex therapy is basically kind of bringing two fields together. It is the study of sexology and psychotherapy and where those two intersect. So it is basically a therapist that has training, background, and understanding in human sexuality, and that is a part of the way that they work and the filter from which they work from.
So would it be then, so I'm trying to think about like when patients are looking for a therapist, would they be seeing a psychotherapist and a sex therapist at the same time, or is it like one person can do both, or how does that work?
Well, you're going to hear this a lot from me today. I'm always going to say it depends, it depends, it depends. It depends what's going on. But how I explain it to people is you can't be a sex therapist without being a therapist first. And so every sex therapist does have a psychotherapy background and are equipped to work with you on general level issues and problems that anybody would come to psychotherapy for. And then they have this added layer of having extra training, extra background, extra specialization in anything related to sex and sexuality.
So when you're looking for a sex therapist, then what are some of the things as a consumer I need to kind of make sure my therapist has or doesn't have, or is there any kind of like, accreditation or something to look for?
Yeah, that's a great question. So, as you said in the introduction, I am what we call an ASEC certified sex therapist. That is from a national organization called the American Association of Sex Educators, Counselors, and Therapists. In my opinion, it's kind of the gold standard of a certifying body for folks who want to be sex therapists. And so, my number one recommendation to consumers looking to work with a sex therapist is definitely looking for that certification designation or somebody who's actively working towards that certification. Somebody who's working towards that certification is being supervised by a certified sex therapist. And so they will have additional support in making sure that they're treating their clients and attending to everything that they need to.
Yeah.
In every state except for Florida, actually, there's no There's no licensing designation for sex therapy. So anybody can technically call themselves a sex therapist. So I really always recommend to people to do their homework and dig a little bit and see what are the processes, trainings, certificates, that kind of thing that they have that allows them to say, this is what I do. I'm a sex therapist.
Yeah, that's helpful because I think a lot of times people don't know what to look for. So it helps to know to look for the training in that specific area as against just going by, what is advertised. So when I'm thinking sex therapy, I'm thinking you're dealing with more than just the individual. You're dealing with, two of them or three of them. So is it possible for somebody to do individual work in sex therapy, or how does that
Yeah,
work?
absolutely. So, and I come from a relationship background, but other sex therapists come from working with individuals, and we can really see anybody. And I'll clarify because I always have to say it out loud. So, sex therapists, we don't do any touch. This is all talk therapy with your clothes on. And we see, I would say, probably 50% of the clients that I work with are individuals that are either they're in relationship or they're single and they have something going on and they just want that time and space to work on it on their own. And then of course, if it does involve being sexual with a partner, then we really encourage, two or more people to come in their partnerships, because it is just so much more effective to have the partner there, when we're talking about, relieving some of the anxiety or some of the issues around intimacy.
And would it be something that somebody can work on even if sex is not a current goal for them? In terms of sometimes I have patients who have had issues using a tampon. They can never put a tampon in. They've never been sexually active. These are young women who are thinking, well, at one point I want to. If I can't get a
Yes.
tampon in, how am I gonna X Y Z? So at what point, like, do we wait for to actually sex be an immediate goal, or is this something that you can work on even when there isn't a partner in the picture?
I would kind of say that really depends on the client, but the scenario that you just described with a younger person who maybe isn't sexually active but is experiencing difficulty with things like using a tampon, it's a great time to seek therapy, especially because then it's on your own terms. There's no pressure about having to being able to perform that kind of thing. It's for yourself. It's for your own understanding what's going on and how your body works. And it's a really safe space. So absolutely, we work with individuals, and sex therapy is so much more than just solving kind of sexual problems. This could
Hmm.
be things around like identity or maybe gender or sexual orientation, all of these different questions that come up for people around who am I? Who am I as a sexual person? That's kind of sex therapists work with all of that stuff. So it could be, um, something like that.
Yeah, and it's good to know that two things: sex therapy is a part of talk therapy, as you clarify, and also sex therapy is not just about sex. So it's such a multi-layer function. So it's
Mhm,
good for people to know that it's not just for, but I don't want to have sex. Well, and maybe it's
mhm,
not that the goal right now, but we can probably work out some of the other issues that go into that, right?
mhm.
So, with that being said, what are some of the common concerns or common situations that you see in your setting?
Yeah. So I'll clarify too. Lots of sex therapists specialize within the field of sex therapy, and I definitely see. I see a lot of different things, but I see a particular. Certain clients tend to come to me. So I work a lot with people in relationships. A lot of people, a lot of them, they have a lot of anxiety. Maybe sex is really good at one point, and then something happens or something changes, and something's changed and they really want to kind of work through that and figure it out. For some people, it is they've never really been able to figure out or have satisfying sex, and they want to improve that. For other people in relationships, we call this in our field, we call it desired discrepancy. So it could be like really different levels of libido or really different sexual interests, and how do you work together to make that satisfying for people. And then on an individual level, I work a lot with what I call vulva owners, or people who identify as feminine or as femmes, anybody who kind of identifies as female. And I work a lot with that connection to body, especially if anybody's experiencing pain or discomfort, maybe trauma or confusion about who they are and what it means to be a sexual person. So that's kind of particularly a subset of people that I work with.
And
And
that's
maybe I
you
can't
hit.
remember your follow-up question. Oh, the common concerns, right?
Mhm.
Yeah. So
But I
that
think you
could
did
be,
answer that in
yeah.
that.
Okay.
Yeah.
Okay.
But yeah, and I have like so many questions from this, but I'm gonna try to like not get too excited and stick to my lane.
There could be
Uh,
a part two.
I
Yeah.
know, right? So one of the first things I wanted to say that it hit a note with me when you said that, especially like, and my language is a little bit more heteronormative, but especially like women who are experiencing that disconnect with their body after an event, and that's sort of what I see, like postpartum people, postmenopausal women, or especially if there was any trauma, not in the sense of like a violent trauma, but you thought your birth was going to go a certain way. 6 months later you have a diagnosis of prolapse or leakage, and now people develop this difficulty with intimacy, not because of any external pressure, but just this internal struggle. So do you have any thoughts on that, on like, is that common? How do you see that? What are some of the things to look for?
Mm-hmm. So I'll say people arrive to me from two different routes. One route is they're working with somebody like you, and the pelvic therapist goes, I think there's something else going on here. All of the work is going well. You're doing everything you have to do. And it seems like maybe there's more of like a mind-heart connection to what's happening here. So I might get referred to somebody who's already seen their doctor, who's been working with a pelvic specialist. The other is they are really afraid of going to a doctor or a pelvic specialist. They know something is wrong, and they do a little internet search and they go, oh, here's this person who I can just talk to about everything. And so sometimes I'm the first line of defense, and sometimes I'm the last line of defense. And that experience around an event, and I'm going to add, trauma, it's not necessarily violent, but it also could be emotional trauma, right? Or something like that. So sometimes I'll have people who maybe they had an indiscretion or had infidelity in their relationship, and it's totally changed who they know of as themselves as a sexual person. Birth and menopause are big ones. Also, aging is a major one we see a lot. Just your body's changing. It's not even
Mm-hmm.
necessarily a singular trauma, right? But it's this ongoing trauma of watching your body change and become different. And so definitely kind of what we work with is helping the mind connect with the work that happens around the physical body that the pelvic or physical therapist is going to be doing. So we really kind of tack on those feelings of what's wrong with me. I feel broken. My body betrayed me. Childbirth, I hear often from folks, I did all the reading. My friends told me what to expect, all of this stuff, and I still can't believe this is happening. My partner doesn't understand. They want me to be XYZ, and I'm, just not there, and I'm not ready. I don't know how to say no to them. So typically I'll see with those events, there's usually something that shifts in how people see themselves and how they understand who they are and what their body is for. I think you probably see this a lot too, is a lot of female identified folks who have gone through, or not even female identified folks, but anybody who's able to birth a child, that they will often all of a sudden feel like all they are is a object, right? That's there to produce, and that's there to clean, and that's there to, take care of.
Mm-hmm.
And then especially when they're experiencing pain from strains, pairs, prolapse, you name it.
Mm-hmm.
It's just this, I'm putting all of this into something, and my body's not even rewarding me by working well, right? It's like broken and it's breaking down. So there's, so we're kind of dealing with the socio-emotional side of that
Mm-hmm.
experience, trying to help the brain. I would say, what we're working on is helping the brain, the heart, and the body all align, and how do they speak to one another.
So that sort of kind of begs the question of like, what's kind of like the normal postpartum struggle, because there's just so much happening after you have a baby. Some people are just touched out, like somebody's on your body all the time, like don't touch me, leave me alone. Some people are just overwhelmed because people are
Mhm.
sometimes back to work, they don't have enough resources, they're tired, and especially like stress with not being sleeping well, stress just gets amplified. So at what point are we thinking, okay, that's just like normal stress of postpartum situations of your life trying to get back to a new normal of having this extra human, and at what point where like you need to talk to somebody, like what
Mm-hmm.
are there any like flashing lights that when I hear as a clinician it's telling me that okay, that's not just you learning how to have a baby in your life, but
Yeah,
that's where we need help, like when do we, and I'm
absolutely.
talking about people who've not had trauma or who are not showing any obvious signs of something went wrong in the birth,
Yeah.
so to speak.
So there's really no kind of hard and fast rule because it depends on people. I think one, I wish we normalized postpartum complications, whether that's postpartum depression or anxiety or just the incredible amount of expectation we put on mothers to be everything and do it all perfectly. And also the disappointment you can feel like you're told this is going to be the best time of your life. You're going to bond with your baby and you're exhausted and you're resentful and you're upset. Um, Big signs to us are prolonged periods of time. So we know that people are going to be overwhelmed, they're going to be stressed, they're going to get weepy, they're going to have breakdowns. I even like to normalize for people what people identify as like really scary thoughts, like maybe I just won't go pick up my baby. They've been crying all day long. Like that's also, it's a part of the deal, right? It's just when you reach your exhaustion, but it's that prolonged. So is it multiple days? Is your partner noticing that you haven't showered, not because you haven't had time, but maybe it's been like 2 weeks and you just haven't been thinking about it. um, I remember my supervisor, I was talking about postpartum once, and she had talked about, I knew something was up for me when I hadn't opened the blinds to my house in over a week. I had been living in darkness with my baby for a
Oh,
week straight. So it's this
these
kind of
little
like,
things.
we dip in and out, and that's to be expected. It's these little things when they start to grow and prolong. That's when I say, okay, you do not have to do this alone. There are people here to assist you and to help you. And how can we get you some support right now?
Yeah, that's actually a very good pointer that going up and down is normal and you don't really know how many ups and downs you're going to have. But as long as you're not staying in one phase of down, I think that's sort of, and let's say we're now talking about somebody who is ready in on their own to sort of like engage in intimacy at any level or all levels
Yeah.
after having a baby. What's sort of like the expectation, so to speak? And I'm not talking
Oh,
about like the physical elements of things, of hormones, because that's sort of a different area. I'm
yeah.
talking about within your realm of niche of what to
Mhm.
expect. And because sometimes I feel like people just, even when I prepare them for pain or lubrication or all the other, especially nursing mothers, there's this huge disparity between what it used to be, and people are like,
And what is
is this
now?
gonna be did I lose it? Like, I have had more than 5 emails of people emailing me, I have lost my G-spot, how do I find it? So and
Yeah,
and depending on what time of the day that email, what time of the night that email was sent, you can tell how afraid that person is, right? So
yeah.
what to
Mhm.
expect, and what's kind of like, again, within normal spectrum of what could happen.
Totally. So I'm actually going to rewind and I'm
Hmm.
going to say one hot tip that I'm going to give folks, especially if we're kind of sticking around preparing to have a child, is a great time to actually work with a sex therapist is before you're going in, because what will help you do is we'll help expand your definition of intimacy and help get you and your partner set up for this idea that sex and enjoyment and pleasure does not just come from having penetrative sex. And I think that so many people, as much as I hear about everything, people do everything you can imagine behind closed doors, but everybody, when I say, what is sex to you? They still tell me it's when a penis goes in a vagina and we have penetrative sex. And really, you must see this often, Darshana, is the minute either that penis or that vagina is having something going on where that arrangement isn't going to work, then you've lost the ability to have sex. But if we can expand what sex is, and if it can include cuddling and really passionate kissing and hand play and using toys and kind of what I say, you want your vocabulary to get larger with sex. When that occurs, then post baby, then you've got all these different options. Okay, I have 5 minutes, we can do this. Okay, baby's taking the longest nap of its life, we can do this. okay, I'm experiencing pelvic complications. We're not going to be able to have penetrative sex, but we can do X, Y, Z. That's really fun and enjoyable. I tell folks too, like, this is not just for post baby, but this is also to deal with that kind of aging thing as well. As you
Mm-hmm.
get older, relying on one way of having sex is works for a small percentage of people, but for most people, it's getting creative and finding other ways to experience pleasure with one another or alone. That's really going to help you dismantle that scary email in the middle of the night that says, shit, I can't find my G spot. And, it helps to say, okay, I've got lots of options here, right? I can take my time with the penetration because we can do this or that. We can have a great shower together. We can do X, Y, and Z. And I think people do get really focused on, I have the lube. We did the time. We did the foreplay. We checked all of the boxes and I can't find this, or this isn't working, or it didn't feel as good as it used to, or it hurt, right? And then the focus is set on, I did everything right and I got it wrong. And it's this failure mentality instead of thinking like, every experience is going to be different. Sometimes we'll do a little bit of this. Sometimes we'll do a little bit of that. I'll taste little things at the buffet, see which one makes sense for me that day. And then I feel like it relieves a lot of that failure mentality that goes along with it.
Yeah, and that's huge. I never thought of it that way, but when you said that, it literally like reminded me of conversations I've had where people will literally go down the list. I did A, B, C, D. I never associated that with like result being failure mentality, but it makes sense because you're already kind of in it as a parent because everything you do is just wrong, is what you see, as a parent. And then on top of it, there's this one thing that you were really good at, and now that's not working. So that can hit harder. So it's really powerful. What I gathered is creating options. So that way you don't feel deprived when you don't get to have that one thing that you associated with the definition of sex. So as you said, the right time to do that is before. So that way you can experiment with things. So
Mm-hmm.
that is in a way predictable, right? Like if you are pregnant, you're going to have this baby at one point, you can read up enough to know like this is going to happen. What if somebody were to have like an unexpected event? For example, sometimes I've had patients with really acute medical complications or what have you that results in a hysterectomy that needs to happen for medical reasons. They're ready, they're prepared, they said yes, right? However, as much as you feel prepared and think that's okay for you, I've seen people have a lot of emotions after because for whatever reason, culturally we associate like having a uterus to you being a woman. And so technically the vaginal anatomy hasn't changed, but for that person, it's changed.
Absolutely.
It's nothing same. So what sort of should be the recommendation for people who are going through that kind of life change? Should they consult a therapist before, or is it only if you have a problem, or how does that
Mm-hmm.
work?
Yeah, I mean, again, it really depends on the person. I think the one thing I'll say, whether it's postpartum or dealing with maybe a cancer diagnosis or a major surgery, sometimes when you're in it, it's really hard to talk about it because you're processing so many things. So for some people, they really want that talk time and the support of a therapist. For some people, they kind of have to get to the other side before they can even reference or talk about it. So it really depends person to person. For that, a lot of these conversations are really broad, but you're naming, it can be really emotional. And I think it's because what we're really talking about is we're talking about a grieving and loss process for people. This happens post childbirth too. You're grieving the life you once had, right? And you're entering into this new phase of life. You said it so well. Our society places so much emphasis on having a uterus, being able to have children, certain parts that are designated as the marker of being experiencing femininity and womanhood or masculinity. And so the kind of one of that process is embracing and acknowledging that there's a grieving process. Two, you can be as prepared as you can ever think you will be up here, and your body and your heart's going to have a totally different agenda for how it hits. And so it really isn't about preparation, isn't going to prevent that loss experience. And so that's a good thing to kind of work with somebody on. And then kind of afterwards, of course, I think one thing our society is really missing is just education about what our bodies are doing as our hormones change, if we go through surgical procedures that alter what's happening physiologically for us, we're taught we're taught, and we're not taught very well. And in lots of cultures and societies, nothing is taught. But whether it's spoken or it's just kind of what you learn, we learn one model of sexuality, which is really based on youthfulness and those years of like high reproductive value. And everybody carries that throughout their lifetime. So, working with women who, if they've had a hysterectomy or maybe entering into perimenopause or menopausal periods of their life, their hormone systems are changing, their endocrine systems are changing, and, things like vaginal elasticity and lubrication are changing significantly for them. Nobody talked about that. Nobody prepared them for that. It wasn't normalized. And so I feel like this huge lack of understanding that
Mm-hmm.
your body is not going to be that of a 15-year-old that's like ripe and ready. And that goes for men too, men who aging and their circulatory system changes, also folks who go through testicular cancer, and, might have their testes removed. There's just so many things that we kind of tell people that there's one way that your body can be sexual, and it has to have all these parts, and it has to work this way. And then when that's missing, nobody talks about it. So I think it is like education. We also have a lot of support groups for folks, that are kind of monitored or by therapists. That's for men's aging, women's aging, sexuality around different identities. So all of these help clue you in. I'm not the only one who's
Yeah.
experienced this.
And sometimes that's all they need to hear, because a lot of questions that I'm sure you get as well are different versions of, is this normal? Am I the only person in the universe having this? And sometimes it's just reassuring to hear that it's common for your age group. And a lot of it is, I think, gazillion years ago, women were not living into their 70s, so nobody thought of like sexuality in 60s and 70s, and now we do, but nobody even got there. So I feel like you're right, like we just have these golden years, so to speak, when things are, and all of that sounds like we are talking about when the tissues are changing, how do we change with them? So it makes me curious as to when the tissues are not a problem, is there something that, because I sometimes see patients for anorgasmia. I've never had an orgasm. What is an orgasm? Like if I ask them, hey, do you have an orgasm? What is it? So I wanted to talk a little bit about, like, from your lens, what is an orgasm? What are you thinking when a patient has a diagnosis of, I've never had that?
Yeah.
So is there, as I said, the tissues are fine. If there's
Yeah.
nothing like that I need to do, who can help them? Because I want to know, where do they need to go
Yeah.
next, right?
So you're talking, and I'm going to expand a little bit. So we've got women, and very, very few, but women who generally have not identified whether they've had an orgasm or not. We've also got the experience of vaginismus, which is this involuntary contraction of the vagina and the muscles, right? So I'm sure a lot of people aren't, one, it's a real thing. So for all of the people out there who are experiencing it, this is real. This is for you. And also we know that is far more somatic and connected to, again, that mind and that heart than anything that's happening physiologically. And, there's a huge range. So I love your question. How do we define an orgasm? One, I like to dismantle what we've decided an orgasm in, which is fireworks, screaming at the top of your lungs, toes curling, all of that stuff. Again, we've kind of painted this picture of there's one way that an orgasm happens.
So are
And
you
I like
telling
that.
me movies and porn lied to us?
They lied. They lied to you. And for some people, it can be this great bodily sensation, but for other people, I've heard it's like a slow, tiny little wave or a ripple. I know some women who can only experience orgasm during certain parts of their menstrual cycle, and other times of their menstrual cycle, they can't experience anything. For some people, it's a full body release. For some people, it's really localized. So it's a range. Orgasms can be a blip, or can be fireworks. It's not always fireworks. And so I think women, one, we're not taught to explore, or we're not given permission to explore and touch ourselves and do solo kind of experimentation. So it's only until we reach a certain time in our life that we go, oh, I think I get to experience an orgasm, right? And then they've been promised this explosive, exciting thing that they've been looking forward to, and it doesn't happen. And so again, a lot of what we're dealing with is the mental obstacle of being told and giving the message of one thing, and very contradictory messages, right? I'm speaking primarily to people who are socialized as female. Don't touch yourself. Don't be a sexual being. Don't get pregnant. All of these don'ts. And then something happens and okay, you're allowed to be a sexual being. You can have sex as long as you're making a baby with your partner. And this over reliance on expecting your partner to know how to give you an orgasm.
Mm-hmm.
Number one thing I think I still find surprising that women tend not to know is that most women or people with anatomies of vulvas are going to, if they reach or experience orgasm, it'll be clitorally. It will not be through penetration or vaginally. And so if you're only having vaginal penetration as your only way of having sex, that's going to decrease your chances of experiencing an orgasm. And so there's a lot of education and kind of normalization around what are we really talking about here? What have you been searching for? What have you been promised? How disappointing is it that we told you you were going to be like Kim Cattrall in Sex and the City, and it turns out, you know, maybe your version of an orgasm is quiet or it's really mysterious. I've worked with people who experienced their first orgasm in their 60s and 70s for the first time. So there's just a lot. One of my, I think, I don't know, can I give reference resources as we're kind of like moving along?
Yeah, yes, sure.
So I recommend every, person, but particular people who familiarize themselves as being female or as a woman, to read Come As You Are by Emily Nagoski.
Yes.
And it's because I think the other thing is we don't know that we have this superpower, which is the clitoris, which I think most women are taught. It's this little bean at the top of your vulva, right? And it's this incredible internal structure that has tons and tons of blood networks and vessels and nerve endings and all of these things that it grows and expands, and it's happening all internally. Nobody knows about it, you know? So
yeah.
If you knew you were walking around with this powerful orgasmic machine.
Yeah, and you're very right. Like in some ways, like women are not given permission or culturally or religiously or what have you. And that often is tied into what they give themselves permission to experience, even when it's time, so to speak, that's okay, or ordained in other words. But I think what I gathered, and correct me if I'm wrong, if everything seemingly seems okay in terms of tissues, like you haven't had any changes hormonally or birth-wise or surgery-wise, and if you've just always struggled with having orgasm, solo or partner, it seems like there is value in exploring psychotherapy more than anything else, because that might be tied into your belief system. Did I get that right?
Absolutely. Yeah. I would say that, and often that's where, folks who are practicing, more from that medical side will refer, right? Because they say, look, we've checked everything out. Everything looks like it's functioning well, et cetera. And so maybe this is really tied to your belief system, your messaging. This is where a sex therapist can be really helpful.
And what are some of the things that make somebody, like when we think about prognosis, like you're going to do really well in sex therapy, or certain characteristics or certain problems where we know that the prognosis is not looking really bright here? What are some of the things that make a person succeed in sex therapy?
So the number one factors that contribute to getting the most out of your sex therapy is one, attitude, that you believe it's going to work and that you like the person that you're working with. So I always tell people, if you meet a therapist and it's just not feeling right, it's not that they're like a bad person or anything, but it just doesn't feel right, don't continue working with that person, because we actually know that the outcomes have a lot to do with just whether or not you feel comfortable with the therapist, especially when we're talking about sex. So even more of a reason. And then the other kind of mindset that we put people in is that sex therapy isn't just that hour that you're meeting with your provider a week. Sex therapy is actually the hour that you meet with your provider a week is just kind of the check-in, and the therapy happens every other hour for the rest of the week. So how willing are you to make space in your life to do some of the work, and I don't love painting it. What I would want for everybody is to have great sex and not associate it with work or being tasked with stuff. But it is readjusting your life. This isn't a pill or a medication where you're going to just see a switch by doing one thing a day. This is really asking you to take on a mental approach, and creating a new mindset in that you are important, and that giving time to this is going to help it be successful. The other thing is, I think people are so polite always, is that tell your therapist outright if you feel like there's something they don't understand or if there's something they're getting wrong, especially if it has to do with those cultural or religious kind of things that clients subscribe to and are really important to them. If your therapist is talking to you as if they're really not understanding, this is the culture that I'm coming from, this is the religious background that I have, I want to stay within my religious practice, it's not going to be helpful. And we can't read minds. So never worry about offending your therapist by saying, hey, I think there's something you're not really understanding here. I'm not super comfortable going there. There's this other consideration that I have, because of my belief system or my culture or my expectations or whatever it might be.
Yeah.
So that's really important.
Yeah, you're right. Because, even within the same culture or same religion, there could be little tweaks that are dependent on the kind of family that you were raised. And it's essentially help your therapist help you. So the more you tell them what's going on, and you're right, sometimes people just they want to please their providers because they're being polite and they just don't want to be the trouble patient, so to speak, and they don't speak up. And that doesn't necessarily go in their favor.
Yeah.
This is really helpful because I did recognize a lot of common things that I see, especially when it comes to emotions being tied into it that go way beyond what's happening in their organs or in their tissues, right? Because a lot of us think that something in the vagina is creating an orgasm, but there's just a lot happening here that we're not.
We have proof that there are some people out there who can think themselves to orgasm.
Right. I was reading that and I was like, oh, okay, well, that's now I call a superpower, right? But thank you, Fiona. That was very helpful. And then next we're going to go into rapid fire questions. But before that, is there anything that you feel like is a because there are patients or people who might be listening in or have heard somewhere else and know that they need to explore sex therapy. They know that's the wrong thing that's next for them, but they're just not ready yet for whatever reasons in life. Are there any DIY resources? And that book is amazing. It's been recommended a couple of times on this podcast, but are there any other things that sort of kind of, I don't know, DIY, like some of it while they're ready to?
Yeah, actually there are some good books. So there's the Vagina Bible. I could also recommend, I'm trying to think of, for people who are in male-female partnerships and want their male partners to maybe get clued in. There's a great book called She Comes First, which helps educate men about how to actually sexually please their partners, which I think is great. And then actually, and this is totally a disclosure about me, because we don't get a lot of funding for sexuality and especially for intimacy and pleasure, and it's not like functioning oriented. Some of the best resources are like through Instagram and on Facebook and educators online. So I would say like actually Erica Hart has an Instagram page. She's really great. She also speaks to how she went through breast cancer and had a double mastectomy and spoke to how none of her providers talked to her about preparing for changes in her sex life. So there's that. And I'm sorry, I believe Erica goes by they, them pronouns. And then there's great educators online. There's also, depending like culturally, we've got sex educators from every background you can imagine, from every corner of the world. And so I could probably put a list together and send them to you if you wanted, because I can't think of the names.
Yeah, but no, I think this is helpful too. Thank you so much.
Yeah,
you're right. Like I've seen some really interesting Instagram handles that are very informative, and I think we're just changing the way we exchange information, and that's becoming
And then I'm going to share this resource because I love it, which is it's called Scarlet Teen, and it's actually a sex ed website that's designed for young people, but
Mm-hmm.
it is one of the most comprehensive and well-written websites that I have seen, and
Excellent.
especially for older generations where we really got zero education and information. This is a great place in your private home to explore, to look at some ideas, to get some answers about functionality, what I can do, what can't I do. That's really accessible because it's written to every age level of an audience.
Yeah, that's good to know because sometimes you got to go back and learn. And also for people who are in the time of their life where they're thinking about what resources to give their children as they're growing up. So that'd be super helpful. Thank you so much.
Yeah.
This was a lot of fun. The next thing that I have is called the one thing. And, most things in healthcare are it depends or the answer is long, right? So this part is not for, information in the sense of, long answers, but more like just for funsies as to what's the quick one thing. So we're going to go over some quick questions. And while you're allowed to give just one answer, you can make some exceptions because some
Okay.
questions are meant to be like, really? One answer?
Okay. I'll try. I'll try to go for it.
and the inspiration for this segment is essentially patients always asking me, what's the one thing I can do for this or that, right? So feel free to chime in at the end with any questions that you keep getting or any concerns that you keep getting that I didn't hit on. Okay, so what's the one thing that you most commonly see, in your practice as a problem or a concern or a diagnosis? The one thing that you most commonly see.
Anxiety about not doing sex right.
Yeah. What's the one thing that you think is the most common myth about sex therapy?
That we touch people.
Oh, yeah. What's the one thing that is the major difference between, regular psychotherapy and sex therapy, other than the obvious that you'll be talking about issues related to sex? But if there is one thing that is different.
We have more medical training and background in what's happening for you physiologically and how that's influencing your socio-emotional wellness. So most psychotherapists will not get an in-depth training in that, particularly around sexual physiology.
Yeah, and that makes sense because there's just so much going into it in sex more than just psychotherapy. So that makes sense that you're more medical exposure in that area. So, what's the one thing that you would want to give as a piece of wisdom for postpartum intimacy?
Get creative and think about pleasure, not success.
Yes. What's the one wisdom advice similar that we're giving for somebody who has had any chronic issues like chronic IBS or cancer or any chronic health condition that has nothing to do with having babies?
You are still absolutely sexy, and there is so much available to you to be a sexual person.
What's the one thing that you would recommend for somebody who is having sort of like body awareness or body image shame related issues? What's the one piece of advice for them?
My advice for that one, this one's the complicated one, right? Is that is that it's going to take a little bit of time, and try and find the little things that you really love and appreciate about your body. It doesn't have to be grand and it doesn't have to be exaggerated. Just find these little things in which you feel like your body is doing something for you, and start there. And you don't have to all of a sudden love all of the parts that have been really, really hard to love. So just focus on the little pieces, the little parts that you do appreciate, you do feel like really work for you, and start there. And then we can get to the ones that you have more complicated relationships with.
And what's the one thing you would say to somebody who's saying, why can't I just have sex? And these are people who've previously, whatever previous to episode, they've been fine by their definition. And now suddenly, like, why can't I just have sex when there isn't any problem? So what's the one kind of advice
The
for them?
one thing I would say is, I'm so sorry we sold you a lie that sex is this one thing. Um, and my advice is redefine what sex is to you.
Okay. And what's the one thing we want to tell people where they feel pressured by in a partnered relationship? They feel like, well, my so and so doesn't get it. Like,
Mm-hmm.
what's the one thing we're telling them?
So I'll go with this with two levels.
Mm-hmm.
One is that you have permission and you are allowed to, first of all, figure out how to be a great sexual partner to yourself before you ever need to be concerned about being a good sexual partner to another person. And so even just the mindset of my partner's not getting this feels like they're more concerned about pleasing their partner than they are about pleasing themselves. And two, that's really connected to, which is a big buzzword right now, but is this idea about consent conversations. And I think a lot of partnerships depend on what we call the sexual scripts or the cues that they've always depended on. So like imagine you're following a movie script and you're just going through the motions. And then your partner doesn't get it because they've been reading that same script for a long time and they need to understand that a new script got written. So it's not just about handing them the new script, but it's actually giving them context of to what's been going on.
Yeah, that's a really good question to have two answers for. Two levels of answers for. So I think that was all of the one thing questions. Do you think anything that is interesting or something that you feel like, how did we not talk about this?
Yeah, I think I'm trying to let me think about that for a moment.
Sure.
One thing, is that there are just so many resources out there, but again, because sex is like a underground topic, it's really about kind of accessing those resources. So that's another thing a sex therapist is great for. I think the other thing I want to make sure folks know is that unlike traditional psychotherapy, you might only work with a sex therapist for like 3, 4, 8 sessions. It's not necessarily like this like ongoing, you're sitting on the couch like forever, because we usually are kind of a little bit more focused on helping to relieve some of your concerns or your anxiety about sex and sexuality. I think that's it.
Yeah, that's very interesting to know
Yeah.
because I don't know why, but I made an assumption that it will be a long-term relationship, but it's actually the exact opposite because I just drew parallels with psychotherapy. So
And yeah, it totally depends on like what people are coming
yeah,
in
it
for and what
can
they
be.
want. But I just, because I think people are like, I don't want to start therapy because it's going to be a year, and
Mm-hmm.
I'm like, well, not necessarily.
Yeah.
And then the only other thing I would tell people is there's no better time to do sex therapy because we're all online right now. And you can work with anybody in the country that's an ASEX certified therapist. And so if you're just kind of curious or you want to know what it would be like, this is a really, really great time. Mhm.
Yes, yeah. That's one good thing about Corona that everybody has access to care from their home now, right?
Mhm.
All
And the
right.
privacy of their own home. You get to talk about sex in your own home, right?
Yeah.
Instead of going to a stranger's
Yeah,
apartment.
yeah. You're
So,
just a little more comfortable. Yes. Thank you very much, Fiona. This was super helpful. I'm going to put all the resources that you shared in the show notes, but thank you very much for your time.
you're
And
so
I,
welcome.
I really enjoyed myself. I think there's going to be a part two because I had to like hold back so many questions because that would be on tangents. And while that'd be interesting, I wanted to like stay in one lane. So we'll talk about that offline. But thank you
Okay.
so much. Have a wonderful rest of the day and peace out, guys. Bye.
Bye.